Hello, I'm Dr. Younas. I'm a GP and clinical lead of ABL Health, and I'm going to be talking to you about many concerns that patients have about their medical conditions or medication that they're on when it comes to losing weight. And I'm hoping that I can give you some assurance that it's not impossible to lose weight. It's all about knowing how to deal with these issues. Lots of factors can impact on a person's ability to lose weight. And many of our patients will say that because of a certain medical condition or because of certain medication that they're on, that they just can't lose weight. And our experience has actually shown that that's not always the case. We've had many patients who have conditions that actually can make it harder to lose weight, or can even make them more likely to gain weight, who actually with our support, with some of the things that we teach, actually they've managed to lose a good amount of weight. And some of our greatest successes have been with in patients who have conditions that can be limiting in terms of weight management. So that's what I want to do. I just want to reassure people that it's always possible to lose weight. So arthritis is a very common complaint that many of our patients seem to have. There are two types of arthritis. One is an inflammatory type arthritis, where you get joint inflammation. It tends to affect multiple joints, and patients tend to be seeing a rheumatologist, a specialist in arthritis. These patients may be on some very specialised medications to manage inflammation of the joints. It's not the most common arthritis. The most common one is osteoarthritis, or as some doctors call it, wear and tear arthritis. This is something that people are more likely to get as they get older, particularly with extra weight, because it puts extra pressure on the joints, and that can have an impact on those joints, developing changes due to all that pressure. So patients with arthritis often experience a lot of pain. Sometimes they experience swelling. It can be the thing that stops a person trying to do exercise as part of their lifestyle change. And I'll just show you a sort of a diagram of what tends to happen. So this is my mini whiteboard. So essentially what people experience is joint pain. From that, they don't really feel they can move about as much as they would like to, and for that reason, it can impact on their weight. They can end up either gaining weight or just really struggling to lose weight. Then with weight gain, that can lead to further joint pain, and then again even more limited activity. So that's the cycle we really want to break, and the way that I would recommend that be broken is basically to manage pain. So a lot of people think, oh, if I take painkillers, I'm masking the problem, I might make the problem worse. But actually, doing physical activity, keeping the joints moving, just helps to keep the muscles stronger, supple. Those muscles and tendons will support the joint better. And it does help to reduce the progression of arthritis, particularly osteoarthritis. So actually, exercise is really important, for the arthritis itself. And what we like people to do is make sure that their pain is well controlled, because if it is controlled, they're more likely to move more naturally, and they're less likely to pull other muscles, causing other types of injuries. So actually, pain relief is really important. If you do feel that your pain management is not quite adequate, then I would really recommend that you see a GP and make sure that you have a pain medication review, so that you've always got something to take as needed, as well as something regularly if you need to have something more regularly. You might want to dose up a little bit before an exercise routine. That would just, as I say, that would make you more effective at doing the physical activity, and you're less likely to injure yourself as well. Now, one important point that I really need to make is that exercise that we recommend is really based on what a person can do. So, one person who has arthritis compared to someone who doesn't have any, their activity levels, their ability to do certain activities are going to be different, and that's completely fine. What we don't do is prescribe a certain type of exercise for all patients, because we know that that's not realistic. So it is very much paced according to that person's conditions. Our lifestyle coaches would be able to guide each individual as to the type of activity they can do. So there you have it. That's a little bit about arthritis and weight management. I hope that gives you confidence, that you can actually lose weight despite having conditions such as arthritis. And I wish you the very best on your weight management journey.